Hello, dear friends. Have you ever reached for that familiar bottle of mouthwash, thinking you're doing the absolute best for your smile and your breath? It's a common habit, a ritual for many of us, aimed at keeping our mouths fresh and clean. But what if I told you that a certain type of popular mouthwash, one that many of us have on our bathroom shelves, might actually be silently undermining your oral health, especially if you're over the age of 65? It's a thought that might be a little unsettling, I know. Recently, warnings have surfaced, even from dental professionals, suggesting that some widely used mouthwashes could be contributing to oral health problems, rather than preventing them. This is particularly concerning for those of us in our golden years. So today we're going to gently unpack this. We'll explore why your mouth needs a different kind of care as you age, what might be lurking in that popular mouthwash, and most importantly, how you can protect your precious smile. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. First, let's understand something important. As we journey past 65, our bodies undergo many natural changes, and our mouths are no exception. The delicate lining inside your mouth, known as the oral mucosa, tends to become a bit thinner and more sensitive. Saliva production, which is our mouth's natural defense system, often decreases. This can lead to a drier mouth, and our teeth, well, they've been with us through thick and thin, and they might show signs of wear, or perhaps gum recession has occurred, exposing more sensitive parts of the tooth. All these changes mean our mouths can become more fragile and more susceptible to irritation and problems. Now let's talk about that popular mouthwash. What exactly is in it that could be causing concern? One of the main ingredients in many traditional mouthwashes is alcohol. You know that strong, sometimes burning sensation you feel? That's often the alcohol. While it might give a temporary feeling of cleanliness, alcohol is a powerful drying agent. For a mouth that might already be prone to dryness due to age-related changes, adding more drying agents is like pouring fuel on a fire. This dryness isn't just uncomfortable. It can also disrupt the delicate balance of bacteria in your mouth. Yes, there are good bacteria in your mouth that you need. When this balance is thrown off, it can paradoxically increase the risk of problems like bad breath and even infections. Then, there are the strong antibacterial agents. Many popular mouthwashes pride themselves on their ability to kill germs, and they certainly do. However, they often act like a broad-spectrum antibiotic, wiping out not just the harmful bacteria, but also the beneficial bacteria that play a crucial role in maintaining a healthy oral environment. Think of it like this. Your mouth has its own little ecosystem. If you constantly use harsh chemicals, you disturb that ecosystem, potentially allowing more resilient, harmful bacteria to thrive or creating an imbalance that leads to other issues. And it doesn't stop there. There can be other potentially troublesome ingredients. Certain artificial flavorings, colorants, or even some sweeteners, while making the product more appealing, might irritate the sensitive tissues in an older adult's mouth. Over time, these seemingly small irritations can add up. So, what are the long-term consequences of regularly using such a mouthwash, especially after 65? Well, that persistent dryness we discussed can become a chronic issue, leading to what's known as xerostomia, or dry mouth. And as I mentioned, a dry mouth can actually make bad breath worse because saliva is essential for washing away food particles and neutralizing acids that cause odor. The constant exposure to harsh ingredients like alcohol and strong antiseptics can also irritate and inflame the delicate lining of your mouth. This can lead to soreness, redness, and even painful mouth ulcers. Constantly irritated mouth is also a mouth with a weakened defense system, making it more vulnerable. And what about your teeth? When the natural balance of your oral flora is disrupted and your mouth is excessively dry, your teeth can become more susceptible to problems. This environment can encourage the demineralization of tooth enamel, which is the hard, protective, outer layer of your teeth. This can lead to increased tooth sensitivity, that sharp twinge when you eat something hot, cold, or sweet. More alarmingly, it can increase your risk of developing cavities, even root cavities if your gums have receded. It all sounds a bit worrying, doesn't it? But please, don't feel disheartened. The wonderful thing is that armed with this knowledge, you can make informed choices to protect your oral health. So, what's the scientific, gentle approach to oral care as we age? It really starts with the fundamentals. Done correctly and consistently. Brushing your teeth properly is paramount. Aim for twice a day, once in the morning and especially before bed. Use a soft bristled toothbrush to be kind to your gums and enamel. Consider the base brushing technique, holding the brush at a 45-degree angle to your gums and making small, gentle, circular or back and forth motions. This helps to clean beneath the gum line effectively. And remember, take your time. 2 full minutes of gentle, thorough brushing is ideal. Now, if you enjoy using a mouthwash, or if your dentist has recommended one for a specific reason, the key is to choose wisely. Look for mouthwashes that are alcohol-free. This is a big one. Opti. For formulas with gentle, soothing ingredients. There are many products available specifically designed for sensitive mouths or to help with dry mouth. Read the labels carefully. We'll touch on some good alternatives shortly. And perhaps one of the most crucial pieces of advice: maintain regular dental checkups. Your dentist and dental hygienist are your best partners in oral health. They can spot potential issues early, often before you even notice them. They can provide professional cleanings and offer personalized advice tailored to your specific needs. Don't skip these important appointments. So, what kind of mouthwash should you be looking for if you're over 65 and want a gentler option? Instead of focusing on killing all germs, think about supporting a healthy oral balance. Look for mouthwashes containing ingredients like xylitol, which is a natural sweetener that can help prevent cavities by inhibiting the growth of certain harmful bacteria. Some gentle mouthwashes use ingredients like aloe vera, chamomile, or tea tree oil for their soothing and mild antibacterial properties. If dry mouth is a concern, there are specific moisturizing mouthwashes that can help lubricate the mouth and provide relief. These often contain enzymes or cellulose derivatives to mimic saliva. Fluoride mouthwashes can also be beneficial, especially if you're at a higher risk of cavities, but use them as directed by your dentist. The main takeaway is to choose products that are kind to your mouth, that don't contain harsh alcohol or overly aggressive antiseptics. Your pharmacist can be a great resource here. And of course, always discuss options with your dentist. To sum it all up, that popular, often alcohol-laden mouthwash that promises an intensely clean feeling might, in fact, be too harsh for the changing needs of your mouth after 65. It can contribute to dryness, irritate your delicate oral tissues, disrupt the natural balance of your oral microbiome, and potentially increase your risk for certain dental problems. But the wonderful news is that you have the power to choose differently. By understanding your mouth's needs, practicing gentle yet effective oral hygiene like proper brushing, and selecting an appropriate, alcohol-free mouthwash, you can continue to enjoy a healthy, comfortable smile for all the years to come. I truly encourage you to take a moment to look at the ingredients list of your current mouthwash. Is it high in alcohol? Does it make your mouth feel overly dry or irritated? Perhaps it's time to consider making a switch to a gentler alternative. Your oral health is such an integral part of your overall well-being and quality of life. It affects how you eat, how you speak, and how you feel. Let's make conscious choices to nurture and protect it. If you found this information helpful, please consider sharing it with friends or family who might benefit. And if you have a favorite gentle mouthwash that has worked well for you, feel free to mention its type or key ingredients in the comments below. Your experience could help someone else on their journey to better oral health. Take good care of yourselves and keep smiling.